I almost didn't recognize you. It's been way too long. How are you doing? Fine, thank you for asking. So, we're doing your head-to-toe exam today, yes? Okay, perfect. Can I have your full name again? I mean, I have it here, but just in case I have the right person. Oh, what a beautiful name. And it's been, what, a year since your last exam? Oh, no, you haven't aged one bit. You're more youthful and radiant than ever. Oh, thank you. Oh, I appreciate it. I am getting a little old, though. And as you know, I'm Nurse Coco, twin sister of Dr. Coco. Yeah. And I'll be doing your history and a little bit of the preliminary tests, okay? All right. Now, my hands are already clean, and I'm just going to ask you a few questions before we begin. All right? Yes, of course. So, have you had any changes to your health since our last exam? Mm-hmm. Mm-hmm. Hmm. When did that start? The cough? Okay. About a month ago. And you got tested negative, yes? I have that on your file. Okay, just so we're safe here. Okay. Well, I can definitely check or have Dr. Coco check that out. Okay. Any changes to your medication or any supplements? Oh, okay. So you started taking some adaptogens. Very nice. Did someone prescribe that to you? Oh no, okay. Just something that you thought would help you? Well, we can always ask Dr. Coco and see what she says about that. Absolutely. Well, from what I understand, adaptogens can be really helpful for reducing stress and improving the immune system. Yes, definitely. Okay. Now, any other conditions or symptoms that you'd like me to know? Anything regarding your skin, hair, and nails? No? Okay. Your head, eyes, ears, or nose? Although we're going to look at all of that as well. No? Okay. Anything in your throat? Okay. Just the cough? Yeah. Chest and lungs? Anything other than the cough? Okay. Any heart issues, palpitations, anything like that? No? Okay. Very good. Any abdominal, digestive problems? Oh, a little bit of GI upset lately? Okay. We will definitely check that out for you. Any issues with balance, coordination, dizziness, anything neurological? No? Okay. What about muscles? Any muscle weakness, pain, any kind of pain at all? No, you're good? Perfect. That's what I like to hear. Okay, so I'll go ahead and get started with the vitals. Just gonna put this aside. Just make yourself comfortable. There. Okay, I'm just going to have you just take off Just going to have you open your mouth. Yeah, and I'll put this under your tongue, okay? Perfect. And I'm just going to check your pulse. Yes. Yes, you're doing great. I'm just going to make a note of all of that. So good news, no fever. 6.5. Respiration rate is 18 breaths per minute. And heart rate is 65 beats per minute. All good in that department. Very good. Now I'm just going to take your blood pressure. Okay. So, do you have a preference in terms of which arm you prefer? This one here? Yeah, of course. Yeah, you can just relax your arm right there. Perfect. And as you know, we do things a little differently compared to other people. I'm going to be checking your pulse and then pumping this up. And then I'll have you put up your fist and do the fist. Oh, you're familiar with it? Okay. Well, I'll just guide you through it. Okay. So just relax your arm. Yes, very good. Okay, just looking for when your pulse disappears, and good. Okay. I want you to just raise your hand and pump your fist 10 times just like that. We're just going to get the blood to circulate again. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Just relax, okay? I'm just going to release slowly. Just listening for the Korsakoff sounds. And 110 over 70. Very good. Amazing blood pressure. I'm so happy. There we go. I don't think you have a history of high blood pressure or low blood pressure or anything like that, right? Yeah. Okay, so now that we have your vitals, I'm going to be doing a few more checks just really quickly, okay? Place this on this side. Let's do this. So I'm going to take your hip circumference and your waist circumference, okay? So just want you to stand up. And let's first check your waist circumference here. Okay, so about 35 inches, 89 centimeters, very good. Okay, and then I'm just gonna check your hips, just around here, okay? Very good. Okay. 45 inches and 114 centimeters. That's pretty good, actually. What I'm looking for is the waist to hip ratio, and I definitely want it to be less than 1:1. So it's good that your waist is about, what did I say, 40, 35? Yeah, that's well under the 1:1 ratio, so very good. Now we're going to be measuring your body weight and your body fat percentage. Okay? I'm just going to grab the scale. I'll be right back. Just coming behind you right here. Okay. All right. I have this scale. It's a Japanese scale, and it's really helpful for measuring both weight and body fat percentage. So before we measure weight and body fat mass, I'm going to be checking your height, okay? So just stand up for me. Good. Just going to step on that. And okay. All right. So you seem to have gotten just about half an inch shorter compared to last time. Okay, so you're 4'9". I'm just going to write that down. Okay. And now we can check your weight. All right. So I'm just going to set this up for you, and I'm just going to put down your age. Okay. And your gender. Okay. And your height. Will you go ahead and step on that for me? Yeah, I'll just push it towards you. Okay. So we're just waiting on the results right now. Okay. So according to this body fat machine, or body fat measurement machine, you are at the perfect body fat percentage for your height. Yes. although maybe just a little bit on the higher end, but still average, which is good. And your BMI is also excellent. Yeah, for sure. Great job. Okay, I'm just going to put that away. I'll be right back. All right, dear. Here is your gown. I'd love for you to put that on, and we can proceed with all the rest of our exams, and Dr. Coco will be here, okay? Good. So go ahead and just put that on. I'll just go and check to see if Dr. Coco can come by. Okay, here you go. You got that? Okay, perfect. Yes, Dr. Coco should be here any minute now. You got your gown on nice and tight there? Perfect. Looks good. I'm just going to open this up and oh, there's no need to be nervous. Not at all. I know doctors can be a little nerve-wracking sometimes, but well, she's my twin sister. She's just as sweet as me. Don't worry. Okay, so we have our ophthalmoscope and otoscope, pneumonic otoscope, and just make sure it's nice and charged. Should probably do the ophthalmoscopy first. Yeah, it's all good. Perfect. Okay, just leave that there. Actually, just put this on for her. Great. Are you ready for me? Yes. Okay. Hi. I'm coming. Oh, of course. I got your ophthalmoscope ready. Oh, do you mind if I just... Yeah, definitely. Okay. Hi, nice to meet you. I'm Dr. Coco. Yes, I am Nurse Coco's twin sister. We've met before, yes? Okay. Well, perfect. So you're all set and ready to go for the rest of our assessments? Wonderful. Yeah, I thought it's best if I left that to you because patient does have a bit of a cough. Yeah, but they tested negative for COVID. Oh. Yeah, exactly. So I'll just head out then. All right, thank you. Do you mind just moving? Yeah, definitely. Just move out the way. Okay. All right. Have a wonderful day. It's been so nice working with you, and I'll see you maybe later today or next year, if anything. Okay? Bye. Bye. Thank you. All right. Let's see what we've got here. It's nice to see you. Okay. Really? Do you think we look that alike? Yeah, we are identical twins. Yes. Oh. These earrings? Yeah, she has one of a different color. Our friend Dania made it for us, and mine are the gold hematite ones, and I know they're beautiful, aren't they? So beautiful. Okay, I will start with your skin and then hair, nails. Okay? Good. Just going to put on a pair of gloves. Oh, let's see if she's got the... All right. You don't have to do anything, just relax. I'm just checking your skin. Let me actually start with your hair. Good. Just doing a bit of a scalp check here. Seeing if there's any... Have you noticed anything with your hair? Any balding or hair loss at all? No? That's good. Any nits or lice? Any eczema, any itchy or red patches of skin? No? Yeah, good. Just take a look on this side, okay? Yeah, it's a little bit dry back here, but overall it looks quite nourished and healthy, so you're doing a really good job. Okay? Very nice. Alright, let me look at the rest of your skin on the face. No breakouts. Very good. On your neck, just look up for me. Okay. Very good. Okay, I'm just going to check your arms now. Also checking the moisture levels and the texture, the temperature. Do you have cold hands and feet at all? That's good. And check your nails. Capillary refill. Clubbing or pits? No. Very good. Okay. Anything on your abdomen? We'll check the abdomen later, so we don't have to worry about that right now. I'm just gonna check your legs. Okay, very good. Yeah. And I haven't noticed any... Have you noticed any new nevi? Any spots on your skin at all that's newer or that's changed since the last time? Yeah, so the key thing we're looking for is any changes in color at the border, any irregularity. Yeah. I didn't see any based on my check. I didn't see any suspicious looking nevi, but if you see anything at all, and if you want to get a more thorough skin check from me, you can absolutely call in and get that done, or I can even refer you to a specialist, okay? All right. Okay. Hands are good. And the symmetry of your head, scalp, hair distribution is good. Okay. I'm just going to check your facial expressions. Can you raise your eyebrows? Puff out your cheeks. Good. Show me your teeth. Good. Can you frown? Okay. Good. Right now there's 7. isn't it? Can you clench your teeth? Okay, release. Good. Clench your teeth again. Okay, release. Very good. Okay, now we're going to be checking your eyes. First, start by just palpating. Close your eyes, please. Just palpating for any swelling. Any swelling of the lacrimal ducts. No, very good. Checking the eyebrows and seeing if there's any kind of thinning, which there isn't. Okay, let's look closer at your eye. Second, do you mind if I come up close? Okay. Now I'm just looking at your sclera and your lens and your cornea to see if there's any opacities. No shadows on the iris. Let me check the other side. Sclera, cornea, lens, iris. No opacities, okay. Let me also just pull your lids down slightly so I can take a look at the palpebral conjunctiva. And then look up. Very good. Okay. Now I'm going to be checking your pupils for direct and consensual constriction reaction. Okay, very good. Okay, just going to do the age test. All I want you to do is don't move your head, just move your eyes, okay? And follow my pen. Very good. Just looking to see if there's any nystagmus, any lag, which can suggest a cranial nerve defect. Yeah, either the lateral rectus or the abducens, ocular motor. Just up here again, just want to check the superior and inferior rectums. Okay, good. Alright, let me check your convergence and accommodation. I want you to look at this pen and then look behind me, right over there. Back at the pen, back at the wall, pen, and keep looking at the pen as I come closer and closer, checking for your convergence. Very good. Okay. Let's check your visual fields. I want you to close this eye right here. Okay. Can you see my wiggling fingers? No? Let me know when you see my wiggling fingers. Very good. Let me know when you see my wiggling fingers. Very good. Let me know when you see my wiggling fingers. Good. Keep that eye closed. Same one. Keep staring into my eye. Let me know when you see it. Very good. Okay. Alright. Switch eyes. I'm just checking, comparing my peripheral visual field with yours to see if you have any defects. That's assuming that I don't have any defects. Keep your eye on me. Good. Very good. Now let's check your visual acuity. Just taking the Snellen chart. Will you please read the lowest line that you can read? Cover this eye. Good. Yes. Okay, yeah. X. Oh, good. Let's try the one above it. 3, 7, 4, 2. Just grab this pencil. And 8, yeah. W, E, or 3 rather. X, oh, great, okay. So that eye there is 20/30 vision, so your right eye. Let's switch over to the other eye and read that same line for me, backwards. X, yeah. 3, yeah, W, 3. 8, 5, yeah, 2, 4, that's right. Okay, let's try the one below it, again backwards. You want to try that one again? Good. Yes. Not quite, but it's okay. So both of your eyes are 20/30 vision. Do you have any correction glasses? Yes, but you don't wear them? Okay. Alright, well, we can have you put on those correction glasses and maybe book an appointment with an optometrist if you like, or you can even download this at home and try it for yourself. Yes, but I'm going to write down our results right now. Okay. Next, we're going to do the ophthalmoscopy. Let me know if this is too bright. No, it's okay. I'm just going to turn off this light back here. There we go. Okay. Just gonna come in from about 15 degrees. Good. Perfect. Just moving slightly to look for that optic disc and cup, which is beautiful, lovely ratio. I don't see any blurriness or swelling, which can suggest papilledema. No signs of glaucoma either, based on the cup to disc ratio, and no nicking of the retina's vessels. much. I don't expect hypertensive retinopathy, but your blood pressure is pretty good, right? Let me just give you a little bit of a break. Yeah, I don't think yeah, your blood pressure is 110/70, so that's very good. A lot of people don't realize that blood pressure, if you have high blood pressure, that can in turn affect your eyes, and it can cause hypertensive retinopathy. That's right, and we don't want that because it could potentially cause blindness, right? Yeah. Okay, let me just look a little bit closer. Good. Retina's a nice yellow-orange color. Beautiful. I don't see any cotton spots or drusen spots or any hemorrhaging. Okay, can you look directly into my ophthalmoscope just for 2 seconds, looking at the macula and fovea? Perfect. Okay. I'm going to come on your other side. Good. Just going to come closer. And very nice. Okay. Again, looking for that cup and disc. Just a second. Sometimes I have to move slightly closer to your nose. And yeah. Again, it's nice and sharp, clear outline. Cup to disc ratio is less than 1/2. No signs of glaucoma. Yeah, the color is beautiful. It's like golden color and a little bit of pigment around the outline. That's normal. Look at the retina here. Any signs of hemorrhaging? No. Any nicking? No. I don't expect that. Cottonwool spots, just spots, no part exudates, nothing. I don't see anything that's peculiar here, no scars of any kind. And now just look directly into my ophthalmoscope for 2 seconds, I know. There we go. Perfect. Yeah, there's nothing to worry about there for sure. Okay. All right. Next, we're going to be checking your ears. So first, I'm going to be inspecting and palpating, okay? Let me come on to this side. Just check my eyes, okay? Let me come on to this side. Just move your hair back slightly. Good. Just pressing the tragus. Any pain there? No? And pulling on the pinna. Any pain there? No? Very good. Okay. Don't see any sort of deformities or scarring, any kind of rash, any foreign objects or discoloration, discharge. Don't see any of that. Let me come over on this side, okay? And take a look at your ear, just brushing your hair back. And any pain when I press down? No? Any pain when I pull on the pinna? No? Good. I'm just going to check your mastoid process too. I have to check on this side. Let me just do that quickly. Yeah, the mastoid process looks fine. Any pain? Okay. Now, just gonna look into the ear canal a little bit. Yep, no discharge, no foreign objects, no kinds of abnormalities. Nothing to worry about there. Okay, perfect. Just going to look inside your ear, okay? Yeah, Nurse Coco's got everything ready for me, which is absolutely perfect. I'm gonna take a look inside your ear. Let me know if you feel any discomfort at all, okay? Okay. There we go. A little bit of serum and wax by just going deeper. Yep, tympanic membrane, nice and pearly gray. I can see all the bony landmarks just fine. The short process and long process, the malleus. Pars tensa and flaccid are all intact, no perforations. No cloudiness or bulging, cone of light is present. Yeah, roughly 5 o'clock. Beautiful. Any issues with this ear before? No? Very good. Let me take a look at the other ear now. Just sit here quickly. Okay. Alright. Okay, again, also a little bit of serum in. That's kind of obstructing the view, but I'm just going to go a little deeper and stay on the anterior and inferior side so it isn't too bad for you, okay? Alright. Tympanic membrane, I can see fairly well. It's just a little dark in there. There's a slight bit of erythema at the top. Have you ever had an ear infection with this ear? You have in the past, okay. But not any time recently. Oh, okay, good. Any pain at all? No? So just the erythema, but the cone of light is present. Roughly 7 o'clock. No perforations, the tympanic membrane, no cloudiness or bulging. Very nice, and I don't see any scarring either, which is good. Just going to discard that. Okay. All right. I will do the hearing test in just a second, but while I still have my, I guess I'll just keep my gloves on. I want to take a look inside your nose and your mouth, okay? So first let's look inside your nose. I'm just going to tip your nose back. Yeah. Okay. Alright, I don't see any problems here. Can you breathe out for me? Good. Other side. Breathe out. Good. Okay. Patency is good. Don't see any signs of discharge or septal deviation or anything like that. Very nice. I'm gonna look inside your mouth. Can you open up? Good. Just come a little bit closer. closer. Say ah. Okay, so I do see a bit of cobblestone appearance at the back of your pharynx, which can suggest postnasal drip. Have you been having sort of the sensation of discharge coming from the back of your nose down? Well, the back of your... And you've been coughing as well, right? Yeah. That could explain it, for sure. Just take a look again. Look here at tonsils. Nope, they're grade 1. Good. Just check your teeth here. And just check if there's any signs of cavities. Nope. Have you had any toothaches? Okay. You've been seeing your dentist. Good. Now, I'm just looking at your tongue. Okay, just touch the roof of your mouth with your tongue. Good. Okay. And your uvulas midline. Just say ah one more time. Just gonna make sure that cranial nerves here are working well. And then stick out your tongue. Good, very good. So that's just your hypoglossal nerve. Okay. Okay, let me just check your sinuses. Just gonna palpate your frontal sinuses, okay? Any pain there? Oh, just percuss. Just gonna keep using. Any pain? Oh, and then I'll check your frontal and then your paranasal. Pain? Pain? I'm just gonna palpate. Any tenderness at all? No. All right. Now let me check your hearing. Okay. I'm going to be using this tuning fork. Now, first I'm just going to do the whisper test. So I'm going to close this left ear and just whisper a 2-syllable word on this side, okay? Kitchen. Yes, very good. Other side. Lovely. First 2 words that came up to my mind. I don't know why. Kitchen, lovely. But let's go ahead and do the Weber test. Let me know if you hear it on both sides at the same time or one side first. Okay, good. That's good. There's no lateralization. Now I'm going to check each of your ears. Okay, so I'm going to strike the tuning fork and then put it on your mastoid process. Let me know when you stop hearing it. And then I'm going to bring it towards your ear and let me know when you start hearing it and stop hearing it, okay? Do you hear it? Okay, good. Let me know when you stop hearing it. Okay. Do you hear it? Very good. Let me know when you stop hearing it. Very good. Oh, sorry, struck it again. Now we're going to go on the other side. Let me know when you stop hearing it, okay? Mm-hmm. Very good. And let me know when you stop hearing it. Very nice. I just keep striking it. Okay. No problems there with your hearing. Have you noticed any issues with your hearing at all? Very good. Okay. Let's check your neck. Just going to check all your lymph nodes. So I'll actually start with your preauricular lymph nodes and your postauricular lymph nodes. Okay, let me know if you feel any pain or tenderness. Your occipital, consular, submandibular, submental, anterior cervical chain, posterior cervical chain. Just going to move your head to the side slightly. Okay. Deep cervical chain. Deep cervical chain. Good. Okay. Let me also check your supraclavicular lymph nodes, so just shrug your shoulders and bring them down infraclavicular. Now I'm going to check your axillary lymph nodes. Let me come to this side. Okay. Pectoral, central, subscapular, lateral. Okay, other side. Pectoral, central, posterior, and lateral. Any pain or tenderness at all during any of that? Because I didn't feel any enlarged lymph nodes at all. Did you feel anything? No? Okay, good. So that's a very good sign that we don't have any sort of infection happening. Okay. Let me inspect and palpate your thyroid. Just gonna move your head again. It's okay. Just checking the bottom. Other sides might be a little uncomfortable, but it's very necessary. Let's check and see if there's any shadow on the thyroid, which might suggest a goiter. Okay. Oops. Just going to listen for any bruit. Okay. hear any whoosh sounds, so that's very good. Okay. Will you shrug for me? Very good. Just testing cranial nerve legend. Okay. Now we're going to do some chest exams. So I'm actually going to start with all your posterior exams, and then I'll move to the anterior, okay? All right. I'm just going to come behind you. All right. So I'm mostly checking I'm going to check your lung sounds first. Just doing some auscultation. Just want to loosen your gown from the back, and if you don't mind, just giving yourself a big hug in the front. And every time my stethoscope touches your skin, all I want you to do is take a deep breath in and out, okay? Good. Okay. Deep breath in and out. Good. Breath in and out. Good. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Very good. Inhale and exhale. Inhale. Exhale. One more. Just on the side here. Inhale and exhale. Inhale and exhale. Very good. Okay. All the lung sounds in the back are clear, which is good to hear. All vesicular breathing. Okay, I'm just going to do some percussion if you don't mind. So just keep hugging yourself the way that you are. Just listening for any dullness. Okay, other side. All right, very good. Okay, I want you to take a deep breath in again. I'm just going to check your thoracic expansion. Okay, deep breath in and out. Very, very good. Wonderful thoracic expansion, perfectly symmetrical. Okay. Do you have any tenderness in your wrist, in your rib area? Let me just palpate. Let me know if you feel any tenderness at all. No? Okay, very good. All right. Now I'm just going to check for egophony. So all you have to do is actually, you can do pectoral obliquity. So just repeat after me. All I want you to say is 1, 2, 3 and whisper it, okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Very good. All right. That I'm basically checking for any hyperresonance. 1, 2, 3. 1, 2, 3. 1, 2, 3. Very good. 1, 2, 3. 1, 2, 3. 1, 2, 3. Good. Alright, no abnormalities there. I don't suspect any kind of consolidation in your lungs, so that's very good. Okay. Let me come to the front and do some anterior exams. So I was planning on doing some anterior exams, but I would like for you to be lying down for that. So before I get you to lie down, I want to do some neurological testing with you. So it's very, very simple. Super simple. Okay, all I want you to do is hold out your arms just like this and check for a pronator drift. Please close your eyes. Okay. All right. Very good. Next, we're going to do finger to nose. So I want you to touch your nose and then touch my finger and back to your nose again, okay? Good. 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 It's going to get a little bit harder. Okay, very good. Okay, perfect. I'm going to check some of the vibration on your feet. Okay, so I'm going to be using this tuning fork, and first I want you to tell me what you feel, right? And I want you to tell me when you stop feeling the vibration. Okay? Alright. Yeah, you can just put your feet right here. Very good. So I'm just going to hit that. And do you feel that? The vibration? Good. Keep your eyes closed. Let me know when you stop hearing it. Stop feeling it, sorry. Very good. Do you feel this? Okay. Let me know when you stop feeling it. Very good. Now do you feel that? Let me know when you stop feeling it. Very good. Come to the other side. Again, rest your other foot right here. Just gonna check the dorsum of your foot first. Do you feel that? Let me know when you stop feeling it. Very good. I'm gonna place that on your medial malleolus. Do you feel it? Let me know when you stop feeling it. Very good. Now we're going to check your big toe. Do you feel that? Let me know when you stop feeling it. Very good. No issues with vibration testing. You don't have any issues with your blood sugar, right? Have you gotten that tested at all? Okay, I can definitely order some lab tests for you. Let me just write that down so I can do that for you. But we usually always test blood glucose and HbA1c. Yeah, it's pretty routine at this point, just because of how prevalent diabetes and insulin resistance is these days. Yeah. Okay. let me check also your reflexes while we're here. So let me start with your triceps. Very good. Okay. Relax your arm, relax, relax, relax. Very good. Your biceps. Relax, relax, relax. Very good. Biceps. Relax. Good. Okay. Patellar. Just relax. Perfect. Other patella. Very good. And then I'm going to check your ankle. Just dorsiflex it. Good. Other ankle. Good. Okay. All right. Neurological testing is done. Musculoskeletal issues. Have you noticed any issues with your range of motion or your muscles at all? So you see a chiropractor? Okay. No issues on that end. Do you mind letting your chiropractor know to send me a copy? Or actually, if you can just let me know who your chiropractor is. Yeah, we can get the receptionist to do that for you. And I can just check in to see that all of this is good. The musculoskeletal, range of motion, strength, your joints, that all of that is working well. Your spine health, of course. Okay, perfect. So we don't have to test that. And now we'll just get you to lie down, okay? And I'll check all your anterior lung and chest exams as well as your abdomen exams, okay? Good. All right. So you look like you're nice and comfy. Let me just drape you, okay, with this. There we go. It's almost like I'm tucking you into. So, there we go. I'm going to listen to your lung sounds first. Okay, so each time my stethoscope touches your skin, I just want you to breathe in and out, just like last time, okay? Breathe in and out. Good. Breathe in and out. Breathe in and out. Breathe in and out. Very good. Other side. Breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. Okay? I'm going to come on your other side just to do all your heart sounds. Okay. Here we are. This time you can just breathe normally, okay? So just feeling for your sternal angle, and the left side is the aortic, the right side is the aortic area. Just listening to your S1 and S2 sounds. Very nice heartbeat. And then the pulmonic area. Good. Tricuspid area. Very nice. And the mitral area. Okay. just gonna switch over to the bell and do the same thing. Aortic, pulmonic, good, tricuspid, and mitral. Very nice. Now I'm going to go ahead and listen to your carotid arteries. So take a deep breath in, and you're just going to hold it. We'll hold it together. Deep breath in. And out. Very good. Okay. And now we can go ahead and move to the abdominal region, okay? So I'm just going to work on the drape here. Can you pull up your gown for me? Okay. Thank you. And I'm just going to move this drape down so we can reveal your abdomen. Very nice. And first I'm just going to auscultate. Listen to your bowel sounds. What time did you eat? About an hour ago? Okay, so I'm expecting to hear a lot of bowel sounds. Let me start from the right lower quadrant. Quite a bit of bowel sounds there. Right upper quadrant. Very noisy. Left upper quadrant. And the left lower quadrant. Okay. Next I'm going to do some percussion to see if there's any masses, any dullness. Okay, there's a little bit of dullness down here by the sigmoid colon. That's probably just stool. Okay. Very good. And then I'm just going to do some superficial palpation. Can you please raise your knees? Like bend your knees? Okay. We're just going to reduce any guarding and just palpating. Okay. Oops, sorry. Just going to do a little bit of palpation there. Let me know if you feel any pain whatsoever at all. Good. I'm going to do a deeper palpation, also seeing if there's any kinds of masses, any kind of pain whatsoever, just let me know. And I'll be watching your face too to see if you're lying to me, because your face shows everything. A little tender there? No, that's just where your bladder is? Okay. Sounds good. That's been quite a long appointment, so I don't blame you at all. Alright. Very nice. Okay. So I'm just going to listen to the bruit, and you're welcome to just close your eyes and nap if you like. Yep, it's totally okay. I'm just going to be listening to the bruit with the bell. Abdominal aorta. Renal arteries. No, no signs of bruit. Iliac arteries. and the femoral arteries. Okay. All right. Now, I know you're looking super sleepy, but I just wanted to let you know that I'm going to set aside these Smart Sweets for you. I really like Smart Sweets. It's only 5 grams of sugar per bag, and this is the Halloween version. It's really, really tasty. Yeah. So go ahead and enjoy that. It's really nice, good source of fiber, very healthy. And I'm trying to give healthier sweets now, but I like to give candies to my patients regardless of their age. So I will put that aside for you, okay? So take all the time you need. Just going to write a few more notes, and then you can head over to the receptionist, all right? And they'll give you your lab tests and all of that. Okay. All right.